Zanzibar, an island tucked away on the expanse of the Indian Ocean, continues to make inroads against malaria. But this success story has come at a great cost. Health Ministry officials in Zanzibar reveal that they faced a daunting task to bring deaths of the leading killer disease in sub-Saharan Africa to a bearable number.
It was affecting the livelihood of our people. It was causing sufferings, it was causing brain damage, it was causing absenteeism at work.
Health individuals who were detected with the malaria parasite, it was around 14% in 2003. But of course, previously during 80s and 90s, the prevalence was very bad, up to around 50–60%, especially among school children.
The malaria program manager, Dr. Ali, says in the past they were complacent and were not aggressive enough to implement World Health Organization recommended interventions.
In this country, we've experienced almost 3 times what we call malaria resurgences.
These proved to be a wake-up call. However, in the mid-2000s, this trend was reversed.
And we did about 4 interventions, indoor residual spraying of almost 95% of households. We encouraged women, especially pregnant women and children, to sleep under mosquito nets. And we used combined therapy of artemether and other drug. And now we are on less than 1%.
Since then, the country continues to make remarkable progress.
Today, we're talking about 0.03% malaria prevalence in this country.
This milestone portrays a spirit of resilience for the past 8 years to overcome a disease which kills over 600,000 people annually all over the world, according to WHO. We visit Zanzibar's central indoor residual spraying warehouse, where the officials keep one of the most successful antidotes. Juma Hassan, a medical entomologist in charge of indoor residual spraying, gleefully shows us some of the tools in fighting the mosquitoes.
The IRS was started in 2006, and with blanket spraying, we cover all districts, 9 districts of Zanzibar, and then from 2012 we started to come down
to smaller villages, and it's now onto target spraying.
We have this exercise since 1968 during operation under WHO and UNICEF. But then now we cover we are supported by PMI, USAID.
Zanzibar has 2 transmission seasons in a year compared to Uganda, which has them throughout the year. So they select the most suited chemicals to spray in the course of the year. However, they have also faced strains that are resistant.
We try to change chemicals after 2 years.
In what appears to be a well-coordinated elimination plan, or eradication at that, the malaria unit has a monitoring system which identifies areas with high malaria cases. This year, they'll only spray about 76 prone areas out of over 230. With net distribution covering most of the country, Juma believes all his countrymen will be catered for by 2018. According to their malaria strategic plan, they hope to discard spraying and they will move on with other interventions.
Our ambition is during that period, there's no any malaria cases.
In January, Zanzibar got over 457,000 nets to be distributed largely to Uganda and Pemba Islands.
And we have different channels which we will distribute, like EPI, antenatal clinic, also in the community.
However, fears of a proper usage keep emerging.
We are using different media to speak in the people that there is importance of using nets in all seasons.
The culture of using net is very high, and that's why you find the net coverage and usage is very high. I think it's unlike Uganda. When you go to the northern part of Uganda and other parts of Uganda, you might find that the situation is different.
Officials here rely greatly on health committees in the villages, NGOs and campaigns at schools, a success story Uganda can learn from.
Of course, Uganda is a much bigger country than Zanzibar, so there is more money. It's bigger in terms of surface area, in terms of population. So I think it needs a little bit more of work than us here.
Maliza Malaria Zanzibar. Stop Malaria Zanzibar. This is a new initiative that the Ministry of Health here in Zanzibar has undertaken under their malaria unit to totally stop malaria. Now they are determined to no longer use the word control malaria like other countries are doing. And it can be seen by the fact that they have their own malaria unit, which is practically a ministry in itself. And when you get here, you can clearly see that these are people who are determined to see the job get done.
Kataa malaria, refuse malaria.
Florence Naluyimba, NTV in Zanzibar.